Hi, my name is Jacqueline Paul, and I'm the project lead for the Mawgli Giginijana initiative. You're going to be hearing from my colleagues Elizabeth Burton, policy analyst, and Heather McNeil, our legal advisor. So we are from the Mawgli Giginijana initiative, which means keeping our children together. And our team works out of the Gwilimuk Glusawakan Mi'kmaq Rights Initiative office. We are working to draft a Mi'kmaq customary code and policies to reclaim Mi'kmaq jurisdiction over child welfare from the province. The work we are doing on the Mi'kmaq Customary Code is an exercise of Aboriginal right and self-governance and does not derogate from the Aboriginal treaty and inherent rights of the Mi'kmaq rights holders. The Mi'kmaq Customary Code and policies will also remain in draft form until they are ratified and can be changed based on the feedback we receive from our stakeholders.
Today we're going to be talking about out-of-home care placement options for Mi'kmaq children. There are several different placement options when a child is taken into care and cannot stay in their home under the voluntary removal of parents and caregiver protocol, specifically customary care, kinship care, foster care, and placements in facilities. Customary care is a least intrusive measure where a child is placed with someone according to the customs of their band. The parents or caregiver, for the most part, are the ones who suggest to the social worker someone to care for their child when they are unable to do so. Kinship care is when a child is placed by the agency with a family member or friend known to the parents or caregiver. Foster care is when a child is placed with someone who may not be known to the child or their family. These are often pre-approved homes by the agency that have offered to care for children. Placement facilities include group homes, long-term treatment, secure care centers that provide higher levels of support to children with complex needs. These are more therapeutic placements that are meant to address specific needs of children who have complex needs and may not be best served in a customary kinship or foster home. We want to elaborate a bit on customary care and how it is different from the other types of care. The big difference is that for customary care, the child is not taken into agency care. The customary carer has the day-to-day responsibility and decision-making as the legal guardian of the child. However, the agency retains the responsibility for making decisions around contact and connection between a child, their family, and their community. In other types of care, the agency has much more decision-making involvement around the care of the child.
We've also been working to develop assessments for kinship and foster carers to make sure that they meet the needs of Mi'kmaq children in their care and keep children connected to their family, community, and culture. The assessments for kinship and foster carers have been based on the 7 sacred teachings and a Mi'kmaq worldview. They also use a trauma-informed and strengths-based approach in their evaluation of potential carers. These culturally appropriate assessments help to ensure that the best carers are chosen to look after Mi'kmaq children. Children in care often have experienced trauma, including the trauma of being removed from their homes, which can sometimes present in challenging behavior. We want to make sure that carers are capable and well supported to meet the needs of children in their care. Social workers can collaboratively work with carers to develop plans to connect them with services, supports, training, and mentorship opportunities to provide them with the best tools to take care of a Mi'kmaq child.
On the issue of facilities, we recognize that the Mi'kmaq do not yet have all the facilities to support Mi'kmaq children and families. We will still need to use some provincial facilities and programming until the Mi'kmaq develop their own. We are working with the Department of Community Services to determine how best to provide care to Mi'kmaq children who are placed in these facilities. Thank you for listening. We hope you keep an eye out on our social media and YouTube pages for our next video on adoption of a Mi'kmaq child. Thank you.
Thank you.